Welcome to the Anxiety Slayer series. Our mission is to assist you with creating more peace and tranquility in your life through anxiety release exercises and supportive tools created to slay your anxiety. Today's Anxiety Slayer podcast is brought to you by Natural Vitality, makers of Natural Calm, featuring nature's relaxing magnesium mineral, which reduces stress symptoms, promotes better sleep, provides sustainable energy, soothes nerves, relieves muscle cramping, supports heart and bone health, and hundreds of other activities in the human body. Visit naturalvitality.com/anxiety slayer to get a free sample of the #1 selling magnesium supplement in the natural market. Welcome to Anxiety Slayer. I'm your host, Shann, and today I'm honored to have a conversation with Dr. Carolyn Dean to anchor our series about the benefits of magnesium for anxiety relief and so much more. And before we begin, I'd like to tell you a little bit more about Carolyn Dean. Carolyn Dean, MD, ND, is a health pioneer with over 35 years of experience with stress management, sleep, aging, diet, and nutrition issues. She's authored 30 books, including The Magnesium Miracle. Radio and TV hosts interview her regularly, including ABC's The View, NBC, and CBS. And some of the other shows include Know the Cause with host Doug Kaufman, Your Health with Dr. Becker, and Health Matters with Christine Crosby, just to name a few. She serves on the Medical Advisory Board of the Nutritional Magnesium Association at nutritionalmagnesium.org. Dr. Dean lives in Maui, where she is far from retired, but still visits the beach most days, swims, snorkels, and thoroughly enjoys her work and play. Most days, not knowing which is work and which is play. Welcome to Anxiety Slayer, Dr. Dean.
Oh, thank you so much, Shann, and please call me Carolyn.
What a pleasure to have you here today. Over the last several weeks, my partner Ananga and I have been talking about the benefits of magnesium for sleep and for anxiety and for a number of other things that, there's so much about magnesium that people don't know. And so today, I wanted to talk more about the benefits of magnesium as an essential nutrient to stave off heart disease, diabetes, asthma, and of course, stress and anxiety. So let's begin by talking about the role of magnesium in our bodies.
Yes, it's so pervasive, the actual element of magnesium. It affects up to 800 different enzyme systems in the body. And it's hard to comprehend unless you give examples. And one of the main ones is that magnesium is required to make energy. Energy is made in little packets called adenosine triphosphate, ATP. Now, what's important about the pathway that makes ATP is 6 of the 8 steps require magnesium. So right away in that pathway, if you don't have magnesium, then you don't have energy. And what happens when you don't have energy? You're tired and fatigued and even apathetic. And then with as you've mentioned several times already, magnesium affects our sleep and our stress levels, our nerves, our heart, our adrenal glands. When you don't have magnesium, all those areas are affected and our body kind of reverberates with this tension and we can interpret that physical body tension as anxiety. Our body just doesn't feel calm. It feels irritated. We want to jump out of our skin and we're exhausted. And then we begin to be anxious about, what's going on with me? So there's this terrible vicious loop that can happen when you get anxious for supposedly no reason, but it can be just low magnesium. And it can be that you have low magnesium and then your blood sugar drops. And we know when our blood sugar drops, the adrenal glands shoot out some adrenaline to push our liver stores of sugars into our bloodstream to get our blood sugar back up. Well, that adrenaline in someone who's already magnesium deficient is going to be like a hammer on the heart and race our heart. Just a low blood sugar in the midst of magnesium deficiency. You've got an anxiety attack, you go to your doctor, and they don't know anything about magnesium deficiency. They're not really looking at hypoglycemia, and all of a sudden you're on anti-anxiety medication.
Right. And I've read that a figure like more than 70% of Americans don't get the minimum daily requirement of magnesium.
Magnesium, yes.
That's wild.
It's atrocious. And, people say, well, gosh, my doctor never told me about this. Well, we did not learn about this in medical school. I had to do my naturopathic training to learn about all these nutrients. However, in med school, I remember I had 200 hours of biochemistry, and right up there on the charts, they had PowerPoints back then. Up there on the screen were the pathways for all the biochemical processes in the body, and they all require vitamins and minerals as cofactors in order for these biochemical processes to work. Instead of going there and telling patients to take a vitamin or a mineral when their biochemical pathways slow down, it all got focused on waiting till enough nutrient deficiency symptoms developed to diagnose a disease and give a drug treatment.
I actually had a doctor tell me these aren't the exact words, but basically that I was silly to supplement my diet with magnesium. So I didn't see him a second time, but
then you know what they say, oh, I never see people with nutrient deficiency, because you just turn around and walk right out. So it's this terrible arrogance that medicine has developed against anything to do with nutrition or nutrient supplementation. And when I've asked in conferences, I remember one at the NIH, the Office of Alternative Medicine, they were looking into all these things, and come to find out that the way the government looks at nutrients, it's only to determine if there are deficiencies, across the board that most people will suffer, and replacing the nutrients, say if someone gets scurvy. So the RDA for vitamin C is only 60 milligrams. I could give you dozens and dozens of conditions that are affected by magnesium deficiency, and I think only a couple, like diabetes. If you have low magnesium, that's a sign of diabetes, but I don't even know if there are any others.
Oh, my goodness. So how can you tell if your body needs more magnesium?
That is one of the reasons why doctors haven't gotten involved with magnesium deficiency, because they don't have an accurate blood test. The blood test that doctors use or hospitals use is called the serum magnesium test. And because the magnesium is actually so crucial for the muscles, so crucial for the heart muscle, if you don't have enough magnesium in your heart muscles, they go into spasm, because that not enough magnesium means relatively too much calcium. They work together. Calcium tightens up muscles or triggers nerve impulses. Magnesium relaxes muscles and relaxes nerve impulses. If you don't have enough magnesium, calcium goes to work tightening everything up. So if your serum magnesium goes low, then your body will squeeze out some extra magnesium from your muscles or your bones. So it's always going to look good. And doctors say, oh, it always looks good. We won't even bother testing it anymore. They test magnesium in an electrolyte panel. So nobody even pays attention.
So how about you and I, though? If, are there symptoms in our bodies that we can become mindful of and realize that it might be time for a supplement? I mean, it sounds like everyone needs to supplement their
Right.
their nutrition. I mean, maybe not you because you know so much, but
Oh gosh, no. How I got involved with this so heavily. I mean, Random House asked me to write the book Magnesium Miracle back in the late 90s. So it wasn't until I started doing research for the magnesium book that I realized that my chronic heart palpitations, horrible leg cramps, Charlie horses, insomnia, neck muscle tension from typing too much, they were all magnesium deficiency. So I'm such a huge advocate because I need it for my own health.
Sure.
For me, if I don't take enough magnesium, I get heart palpitations back. It's like I need it as I would food. Every day, you're not addicted to food. You just eat food for the nutrients your body needs. And same with magnesium. We need it every day. Mm-hmm.
What can we key into besides heart palpitations and muscle cramps? Is there anything else that shows
Sure.
up?
Yes, and I have this in blogs, also in my Magnesium Miracle book. The blog is called Gauging Magnesium Deficiency Symptoms. I wrote this back in June 2010, and what it lists is 100 factors that can indicate that you are magnesium deficient. More than 7 alcoholic drinks a week. If you're angry, if you have angina or anxiety or apathy or arrhythmia or asthma, that's just the A's.
Right. Okay. Gotcha.
Yeah.
Well, we'll make sure to get a link to that blog for sure. The next piece that I'd like to ask you about is, anxiety is
Mm-hmm.
why Anxiety Slayer was created, to help wipe out the fear and discomfort of anxiety. So how can a magnesium drink or magnesium baths or magnesium tablets help calm anxiety?
Well, there's so many ways that anxiety can be created. We started with a few of those. Some people wonder if it's a brain hyperexcitability, is it adrenaline surges? It's likely both of those, and both can be modified by magnesium. Magnesium calms the nervous system. Magnesium is a very important mineral for the adrenal glands. If magnesium is deficient in the adrenal glands, they get hyper irritable and start surging. Like, it's the type of thing where you startle easily at a sudden noise. That's where your adrenals are trigger happy. And the anxiety picture is driven by so many things, and our inquiring mind often tries to put a reason behind the chemical deficiency of magnesium. It tries to find reasons why we're stressed and everything. But I will tell you that if you take magnesium, if you're under tremendous stress, even things that you have no hope of solving, it's affecting your sleep, it's affecting so many things. If you take magnesium, as you say, Epsom salt baths or magnesium drinks, you will calm down so many aspects in your body, so many areas, that you'll be able to cope better. So it is a coping mechanism. It helps your serotonin, your feel-good hormones. It can help with depression. It can help as I said, the hyperexcitability. There's one study I'm looking at right now in my Magnesium Miracle book where it will reduce the hyperexcitability as shown in electroencephalograms of the brain. And all these statistics are available. You can research online magnesium and anxiety and find study after study, but it never reaches the doctor's office because there are no drug reps that are bringing magnesium samples to doctors.
Right. Well, you know what? So then good for you doing what you do, and for Anxiety Slayer and those of us and Natural Vitality and all of the folks that are getting this information out there, because it is such an easy supplement to introduced to your diet, to your lifestyle. At least that's what I've found, and is incredibly supportive. For most of my life, I was very type A, very twitchy, very pitta-brained, if we're speaking in Ayurvedic terms. And as soon as I started adding more magnesium to my life, not only was I feeling better, but I'm certain that I was a much kinder version of myself. Yeah, we have so many stories, and I'm grateful that you're here talking to us today about magnesium. And after our break, we'll come back and talk a little bit more about the root of depletion in our bodies and a little bit more than that. We're talking today with Carolyn Dean of nutritionalmagnesium.org. You need magnesium for hundreds of activities in the human body, yet over 70% of Americans don't get the minimum daily requirements of this vital mineral. And Natural Calm is the #1 selling magnesium supplement in the natural market for over a decade. Did you know that Natural Calm reduces stress symptoms, promotes better sleep, helps relieve headaches, soothes nerves, relieves muscle cramping, supports heart and bone health, and my goodness, the list goes on. Natural Calm is available in a variety of delicious organic flavors, and it's a wonderful anti-stress drink. You can get a free sample of Natural Calm today at naturalvitality.com/Anxiety Slayer. Welcome back. Before the break, Dr. Carolyn Dean and I were talking about how magnesium can help with anxiety. And now we'd like to discuss why a balance of calcium and magnesium is important for good health. Dr. Dean talked about that a little bit earlier, but I would like to take it a little bit further in our interview because it does come up so much and it is such an important partnering. Welcome back, Carolyn.
Thank you, Shann. Yes, that's a perfect question. The focus in mineral prescribing has been calcium for decades. Doctors only got into that aspect of nutrient prescription because supposedly of osteoporosis. Our bones look like they're mostly calcium. So if we have signs of osteoporosis, maybe we should take more calcium, was their thinking. And come to find that over the decades of giving more calcium, we actually have more and more osteoporosis. And we have almost a dozen studies now that are showing that women who simply take calcium supplementation are at higher risk for heart disease. They're also at higher risk for breast tissue calcification, gallstones, kidney stones, heel spurs, fibromyalgia, muscle calcification. It's our body being calcified with too much calcium and not enough magnesium. So when you hear stories about heart disease being increased in women because of calcium, and they say, okay, stop your calcium, they never want to mention that what balances out the calcium is magnesium. Magnesium will actually dissolve calcium in the bloodstream, in the precipitation that you find in soft tissues. It's not going to dissolve it out of bones. In fact, the magnesium will direct calcium to the bones. Bones, if they're just like a calcium carbonate chalk, will shatter when you drop them, or if you drop your body, that's where the shattering of the hips comes into the picture. But if you have enough magnesium to balance out the bone matrix, your bones will be supple. They're not going to be rubbery like children's and infants' bones, but they will definitely not shatter. And that's something that I don't know how long it's going to take us to educate about this. I know I've been partnering with Natural Vitality for decades because they saw right away that my book Magnesium Miracle and my magnesium outreach was important to to magnesium in general. I never really promoted the products. All I did was promote magnesium, but now, decades later, in my next Magnesium Miracle book edition, I say that the Natural Calm magnesium, as you say, Shann, is the most sought after magnesium in the health industry. And that's because it provides the magnesium that we're absolutely missing because we focused so much on calcium. We focused on high dose vitamin D as well, which pulls calcium into the body. If you have too much vitamin D, it actually depletes your magnesium because vitamin D requires magnesium to be activated. So we've created a lot of imbalance of our calcium and magnesium, resulting in a lot of magnesium deficiency symptoms, as well as osteoporosis and all this calcification of body parts.
Well, it's interesting that you bring up the vitamin D part. Vitamin D3 is something that I add to my diet here in northern Michigan because we have such a long winter time, so much darkness. And I just wonder if then I should be increasing my magnesium intake if I'm increasing my vitamin D3 intake in the wintertime.
Yes, exactly. In fact, I only recommend 1 to 2,000 units of vitamin D3 because that, along with, I usually recommend about 600 milligrams of magnesium a day. So combined with magnesium, that amount is what the body you can utilize. If you're giving your body 5, 10, 50,000 units of vitamin D, you throw the balance off completely. And I realized this because I've had so many people come to me. They're balanced on their magnesium. They get a blood test, and your vitamin D is not optimal. Here, take 10,000 units, and all their magnesium deficiency symptoms come back.
Oh my gosh!
Yeah,
yeah, it's a vicious cycle, isn't it?
Mm-hmm.
Oh my goodness!
I've had people who've cut back. They take their magnesium, take their 1 to 2,000 units of vitamin D, and their levels balance out. Now, the vitamin D. I mean, people really need to read about this. If you Google my name and vitamin D is really a hormone, and when a hormone does its work, it doesn't need to be in high amounts anymore. It actually will go to sort of low normal amounts. So vitamin D will look low if you have a lot of calcium on board and not enough magnesium. And all of a sudden, with thinking, well, it's a vitamin, we need to have as high amount as possible. Then we get into this over prescription of vitamin D and then the depletion of magnesium. So I say an optimal level of vitamin D3, which actually is not even measuring the active form of vitamin D. They haven't even got that right. But anyway, I say the optimum level. I know too much, Shann. I'm sorry.
I love it.
The optimum level of vitamin D in my world is about 40 instead of this 60, 70, 80. I think the range is like 30 to 80. So I'm saying, look, just go for 40 and check how you feel. I mean,
sure.
If you're taking vitamin D and it sort of helps for a bit, and then you start getting these magnesium deficiency symptoms, let me just run through a couple: acid reflux, adrenal fatigue, angina, anxiety, atrial fibrillation, high blood pressure, calcium deposits in our arteries, cholesterol, constipation, depression, type 2 diabetes, fibromyalgia, headaches, including migraines, heart attack, IBS, inflammation.
Oh my goodness, it goes on and on.
Yeah, muscle spasms, nerve twitches, seizures, and poor recovery from sports injuries.
Wow. So this just leads us right to the benefits of drinking magnesium drinks and bathing in food grade magnesium and doing all we can to support our bodies.
Mm-hmm. You know what? I know you'll probably ask this, Shann, but just so we don't forget, why don't people take more magnesium? One of the reasons is because doctors just think it's a laxative. And most of the prescriptions for magnesium are magnesium oxide. Magnesium oxide is only 4% absorbed, so it's 96% goes into the bowel, pulls water behind it, and flushes you out with diarrhea. So, what's brilliant about the natural calm magnesium is that it's a powder, you put it in liquid, and you can sip it through the day. Do not just glug it all down at once because that may give you some laxative effect. I mean, there's nothing worse than someone being anxious who already has sensitive bowels. You know how anxiety can cause you to
Sure.
have episodes of diarrhea. So what you want to do with your natural calm magnesium is put your day's dose in a liter of water and sip it through the day. And I'm very focused on this. I'm working with a liquid magnesium as well that has no laxative effect. So I know how important it is to really um, focus on sipping your drink instead of taking it as a dose. And
Right.
have you come across that, Shann? Do you know what I'm talking
Yeah,
about?
I absolutely do. I absolutely
Mhm.
do. And I'm glad that you brought that forward because I think that is not talked about. It's
Mhm.
okay, I need to drink this drink. So
Mhm.
what do? We guzzle the drinks that we drink,
Mhm.
right?
Right.
I have a mason jar, one of the large mason jars full of water, and at all
Mhm.
times, and sometimes it's switched out with the natural calm, or it's switched out with a chaga tincture, or whatever it is that I'm
Mhm.
drinking. I just always have something there. So I'm glad to know, and that you brought this forward, that if you're going to add this to your nutrition, sip
Mhm.
on it. Start out with a smaller dose,
Mhm.
and
Right.
see how your body does. Pay attention to your body. Your body already knows
Mhm.
what you need. So, oh my gosh, it's been such a really powerful conversation with you today, Carolyn. I wonder, is there anything else that you'd like to share about magnesium and our bodies, or anything before we close our conversation?
Um, we've covered so much, Shann. I appreciate the questions. I guess it's to have people really consider um, how when you go to a doctor and you're anxious, the more anxious you are uh, at a doctor's office, the more you say, I can't stand this anymore. I'm going out of my mind, do something, help me, the more drugs you're going to get.
Right.
I mean, I cannot emphasize that enough. The more you panic in front of a doctor, the more that they do want to help you, but all they can do to help you is give you medications and or just reassure you. Or if your anxiety takes a form of heart palpitations and you think you're having a heart attack, and they prove to you over and over again, no, your heart's fine, but they don't give you anything. They may give you excuse me,
Right.
a beta blocker, which has so many side effects. But please listen over and over again to this podcast, because what we're saying is that by saturating your body with magnesium, you will calm your nervous system, your adrenal glands, your muscles, your serotonin levels will be balanced. You'll dissolve the calcification that's causing your nerves and muscles to be irritated. There are hundreds of things that magnesium is going to do for you that will get you out of this vicious cycle of anxiety and medications and not knowing whether or not you're going crazy. You're
Right.
not going crazy. Your biochemistry is at fault here. That's what I keep saying. You don't have an anxiety condition, you have a magnesium deficiency.
Oh, thank you so much. You
Mhm.
you mentioned before our conversation today that you actually have a free gift for our listeners that they can get immediately. Can you tell us about that?
Oh, of course. You can go to my website, drcarolyndean.com. And if you sign up for my newsletter, free newsletter, you can get 4 free weeks of my online wellness program and several free ebooks. I think I have 6 free ebooks now. It's probably too much, but I always overcompensate. Yeah, Shann said I had 30 written books. I think it's up to 33 now, and I have 110 Kindle books. So
Right on.
I just want people to be reading them. So,
Right.
yes. at drcarolyndean.com, or Shann will have the URL where you can go directly to the free gifts.
Excellent. Well, thank you so much for your generous gift and for your time today. I know I learned a lot, and I'm certain that our listeners did as well. Really appreciate you, Dr. Carolyn, and hope that you have a gorgeous day on Maui. And we will do the same here and look forward to speaking with you again soon.
Thank you, and aloha, Shann.
The Anxiety Slayer Academy has a brand new course for you. Introducing New Beginnings, Daily Steps for Self-Acceptance and Peace of Mind. This course offers a supportive pathway to heal your past and slay your anxiety so you can reclaim your life. Visit Anxiety Slayer today to learn more about the New Beginnings course at anxietyslayer.com/support.